Yeah, so there's been a lot of emerging data recently, which has been really helpful to guide our management. So because we know that relapses typically decrease during pregnancy, we often stop medications during pregnancy itself. But because relapses increase postpartum, we often would like to start them again on treatment in the postpartum interval. So in terms of treatments, we know that the platform injectables, so interferon-betas and glatiramer acetate, have quite good safety data in a lot of women. And so we're comfortable continuing those until a positive pregnancy test, can be considered for use throughout pregnancy or stopped, and both are also felt to be safe for use while breastfeeding. Although they're not very strong medications, and so they don't necessarily protect us from relapses postpartum, especially for women who are more active. And so recently we've had more data suggesting some of the oral and infusion therapies can be used around pregnancy in ways that are not necessarily following the product monograph, but we've had emerging safety data. So Tecfidera or dimethyl fumarate recently had data to suggest it may be safe to continue until a positive pregnancy test and then stop, although it's not felt to be safe for use while breastfeeding. And then some of the monoclonal antibody therapies, so ocrelizumab or ofatumumab, we can time those infusions or injection therapies pre-pregnancy to reduce exposure of the fetus while having the mother protected during attempts at conception. So there's more data suggesting they may be able to continue these safely until shortly before they attempt conception. And then those monoclonals, the anti-CD20s, are also having emerging data suggesting safety for use while breastfeeding. Particularly ocrelizumab has some recent data to suggest very low transfer to breast milk. So that's reassuring. And finally, just to mention natalizumab, we know that stopping that can lead to breakthrough relapses. And so if we are having a woman on that, we generally continue that through pregnancy, but with extended interval dosing, and monitor the neonate for blood count abnormalities at birth. But we know that it's not a good medication to just stop for pregnancy, and it can be used while breastfeeding. So we're getting emerging data on these DMTs to optimize treatment around this time.